If you are over 70 years old, what I am about to share with you could genuinely save your life. Not next year, not someday, right now, tonight, before you go to sleep. I am Dr. Daniel Chen, and in my years working with older adults, I have seen a pattern that breaks my heart every single time. Patients who have done everything right, they exercise, they take their medications, they watch what they eat during the day, and yet they still suffer a stroke. A serious, life-changing stroke that leaves them unable to walk, unable to speak, or unable to recognize the people they love. And when I sit down with these patients and go through their daily habits in detail, almost every single time, I find the same thing. A specific food they were eating right before bed. Not junk food, not fast food. In fact, most people consider it completely harmless. Some doctors even recommend it. But after the age of 70, eating this food in the evening, especially within 2 to 3 hours of going to sleep, can trigger a dangerous chain reaction inside your blood vessels that dramatically increases your risk of stroke. I am going to tell you exactly what this food is, why it is so dangerous specifically for people your age, and what you should eat instead to actively protect your brain and your heart while you sleep. Please watch until the end, because the information in the second half of this video is just as important as the food itself. So what is this food that I want you to stop eating before bed? It is high sodium processed food, and the most dangerous forms of it are foods that most people eat in the evening without a second thought. I am talking about canned soups, instant noodles, salty crackers, packaged cheese slices, deli meats like turkey and salami, and even certain whole grain breads that are marketed as healthy but are loaded with hidden sodium. Now, before you say, Dr. Chen, I only have a small bowl, or I only have a few crackers, I want you to understand something important. The problem is not simply the amount. The problem is the timing. And here is why. During sleep, your blood pressure is supposed to drop. This is a natural and essential process that doctors call nocturnal dipping. In a healthy adult, blood pressure falls by about 10 to 20% during the night. This drop is not a small thing. It gives your heart a genuine rest after a full day of work. It reduces mechanical stress on your arterial walls. It protects the delicate blood vessels inside your brain. It is one of the most important things your cardiovascular system does every single night. But when you eat high sodium food before bed, something goes wrong with this process. Sodium pulls water into your bloodstream. This increases your total blood volume. Your heart has to pump harder to move that extra fluid through your body. And instead of your blood pressure falling during sleep the way it should, it rises, or it simply stays elevated all night long, and your heart and your arteries get no rest at all. This condition has a medical name. It is called non-dipping hypertension, and the research on it is alarming. A study published in the journal Hypertension found that people who are non-dippers, meaning their blood pressure does not fall normally during sleep, have a significantly higher risk of stroke, heart attack, and kidney damage compared to people whose blood pressure drops as it should. And the risk is not small. We are talking about a 2 to 3 times higher likelihood of a serious cardiovascular event. Now, here is the part that makes this especially dangerous for you specifically. After the age of 70, your kidneys are less efficient at excreting sodium. Your blood vessels are stiffer and less flexible than they were decades ago. Your autonomic nervous system, which is the system that regulates blood pressure automatically during sleep, becomes weaker with age. These 3 changes together mean that the same amount of sodium that a 40-year-old handles without any problem can be genuinely dangerous for someone over 70. Your body simply cannot manage it the same way anymore. Let me explain exactly how elevated nighttime blood pressure leads to stroke, because I want you to truly understand what is happening inside your body, not just hear a warning and forget it by morning. There are 2 main types of stroke. The first is an ischemic stroke, which is caused by a blood clot that blocks an artery supplying blood to the brain. The second is a hemorrhagic stroke, which is caused by a blood vessel in the brain actually bursting and bleeding into the surrounding brain tissue. High nocturnal blood pressure significantly increases your risk of both types. Your brain is fed by a network of small arteries called cerebral arterioles. Over decades of life, especially if you have ever had high blood pressure, diabetes, or high cholesterol, these tiny arteries become thickened, stiffened, and weakened. Their walls lose their elasticity. They become fragile. Now imagine those fragile arteries under elevated pressure for 7 to 8 hours straight every single night while you are lying completely still and unaware. That is 7 to 8 hours of mechanical stress on already compromised vessel walls. Over weeks and months, this accelerates the formation of plaques inside those artery walls. Those plaques can rupture, triggering a clot that blocks blood flow to the brain. That is an ischemic stroke, or the pressure can simply cause one of those weakened vessels to give way entirely and burst. That is a hemorrhagic stroke. And hemorrhagic strokes are far more deadly than ischemic strokes, with much higher rates of death and permanent disability. Researchers in Japan, a country that has spent decades studying the relationship between salt intake and stroke due to their traditionally high sodium diet, found that high nighttime sodium consumption was one of the strongest dietary predictors of stroke in patients over the age of 65. Not total daily intake alone, specifically nighttime intake, because that is when the blood pressure drop that should protect you simply never happens. The American Heart Association recommends no more than 2,300 milligrams of sodium per day for the general adult population. But for adults over 70, particularly those with existing high blood pressure, many cardiologists, including myself, recommend staying closer to 1,500 milligrams per day. Now let me put that into perspective with some numbers that I think will genuinely shock you. A single can of chicken noodle soup contains approximately 890 milligrams of sodium. One serving of instant ramen noodles contains around 1,500 milligrams. A deli turkey sandwich on 2 slices of bread can easily contain over 1,000 milligrams. That means one seemingly innocent evening meal could use up your entire daily sodium allowance in a single sitting, right before your blood pressure is supposed to drop for the night. High sodium processed food is the most dangerous culprit, but it is not the only food that becomes problematic for people over 70 when eaten in the evening. Let me walk you through 3 others that I want you to be aware of. The first is aged and hard cheese. Many people over 70 enjoy cheese in the evening as a snack or as part of a light dinner, but cheese is high in both sodium and a compound called tyramine, which is an amino acid that causes blood vessels to constrict. Eating cheese before bed can raise blood pressure and trigger arterial spasms simultaneously. In older adults who already have some degree of atherosclerosis, arterial spasms can cause what is called a transient ischemic attack, which most people know as a mini stroke. A TIA is not something to brush off. It is a serious warning sign that a major stroke may be coming, and it requires immediate medical attention. The second is alcohol, even just 1 glass of wine. I know many people over 70 enjoy a glass of wine in the evening and have heard that it may be good for the heart. I want to be honest and direct with you about this. While moderate alcohol consumption may have some cardiovascular benefit in younger adults, the picture is quite different after the age of 70. Alcohol initially lowers blood pressure, but then causes a significant rebound surge several hours later. For most people, this rebound happens at 2 or 3 in the morning, the exact time when you are in your deepest sleep and completely unable to monitor yourself. This nighttime blood pressure surge has been directly linked to early morning strokes. Research consistently shows that strokes occur most frequently between 6 and 10 in the morning, and nighttime alcohol consumption is one of the key reasons why. The third is high glycemic foods eaten late in the evening. This includes white rice, white bread, pasta, and sugary desserts. When you eat refined carbohydrates before bed, your blood sugar rises rapidly. Your pancreas releases insulin to bring it back down. But in adults over 70, insulin sensitivity is often significantly reduced. This creates erratic blood sugar patterns during sleep, with sharp rises and falls that your body struggles to manage. Fluctuating blood sugar causes inflammation in blood vessel walls, increases stickiness in the blood, raises clotting factors, and promotes plaque formation. All of these effects directly increase stroke risk. For seniors who are diabetic or pre-diabetic, which is an enormous percentage of people over 70, nighttime blood sugar instability is independently associated with increased cardiovascular events. Now, I want to talk about warning signs because a stroke almost never comes without any warning at all. Your body speaks to you, and knowing its language could be the difference between getting help in time and suffering permanent damage. The classic warning signs of stroke are captured in the word fast. F stands for face drooping. One side of the face suddenly droops or goes numb. Ask the person to smile. If the smile is uneven or one side does not move, that is a serious warning. A stands for arm weakness. One arm suddenly becomes weak or numb. Ask the person to raise both arms. If one drifts downward on its own, call emergency services immediately. S stands for speech difficulty. Sudden slurred speech, the inability to find words, or the inability to understand what someone is saying. T stands for time. You call emergency services the moment you observe any of these signs. Every single minute matters. Brain cells begin dying within 4 to 6 minutes of losing their blood supply. The faster treatment reaches you, the better your chances of a full recovery. Beyond these classic signs, there are subtler signals that can appear days or even weeks before a major stroke. These come from what doctors call transient ischemic attacks, or TIAs. A TIA causes the same symptoms as a full stroke, but they resolve on their own. Within minutes to hours, many people experience a TIA, feel fine again, and do nothing. This is one of the most dangerous mistakes an older adult can make. Research shows that approximately 10 to 15% of people who have a TIA will suffer a full stroke within 3 months without treatment. A TIA is your body sending you a final warning. Please treat it as one. Watch for a sudden severe headache that feels unlike any headache you have had before, especially one that wakes you in the early morning. Watch for sudden blurred or double vision, sudden difficulty walking, unexpected loss of balance, or a spinning sensation. Sudden numbness or tingling on one side of your face, arm, or leg, and sudden brief confusion where you cannot remember where you are or what you were doing just moments ago. If any of these happen, do not wait to see if it passes. Call your doctor immediately or go to the emergency room that same day. Every person over 70 should own a home blood pressure monitor and use it every single morning before eating, drinking, or taking any medication. If you consistently see a systolic reading above 140 in the morning, that is a red flag that your blood pressure is rising during the night instead of falling. Combined with evening sodium intake, that pattern is one of the highest risk combinations I see in older adults. Now, let me tell you what to eat instead, because this is not just about removing dangerous foods, it is about replacing them with foods that actively protect your brain and your cardiovascular system while you sleep. The first is bananas. A banana is one of the best evening snacks you can eat after 70. It is rich in potassium, which is the mineral that directly counteracts sodium in the body. Potassium relaxes blood vessel walls and helps your kidneys flush excess sodium out of your system. Research published in the American Journal of Physiology has shown that increasing potassium intake is one of the most effective dietary strategies for reducing stroke risk. One medium banana gives you about 422 milligrams of potassium. Eat one about an hour before bed. The second is a small handful of walnuts. Walnuts are rich in omega-3 fatty acids, specifically alpha-linolenic acid, which reduces inflammation in blood vessel walls, lowers triglycerides, and reduces the formation of blood clots. A study in the Journal of the American College of Cardiology found that regular walnut consumption was associated with a 19% lower risk of cardiovascular death. 7 to 10 walnut halves in the evening is all you need. The third is warm milk. Milk contains both potassium and magnesium, two minerals that are essential for healthy blood pressure regulation. Magnesium is particularly important because it relaxes the smooth muscle cells that line your artery walls, allowing blood to flow more freely with less resistance. A very large percentage of adults over 70 are deficient in magnesium without knowing it. A warm glass of low-fat milk before bed is one of the simplest cardiovascular habits you can build. The fourth is kiwi fruit. A study from the University of Oslo found that eating 2 kiwi fruits 1 hour before bed every day for 8 weeks significantly reduced blood pressure in people with mild hypertension. Kiwi is rich in vitamin C, vitamin K, potassium, and natural compounds that also improve sleep quality. Better sleep directly means better blood pressure regulation through the night. The fifth is unsweetened tart cherry juice. Tart cherries are one of the very few natural food sources of melatonin, the hormone that regulates your sleep cycle. They also contain powerful antioxidants called anthocyanins that reduce inflammation in arterial walls. A small glass of about 240 milliliters of unsweetened tart cherry juice before bed has been shown in multiple clinical studies to improve sleep duration and reduce systolic blood pressure in older adults. Beyond what you eat at night, I want to leave you with 3 daily habits that together can dramatically reduce your stroke risk. The first is to drink water consistently throughout the day. Dehydration is one of the most overlooked stroke risk factors in older adults. As we age, our sense of thirst weakens significantly, meaning many people over 70 are chronically mildly dehydrated without ever feeling particularly thirsty. Dehydration thickens the blood, making clots far more likely to form. Aim for 6 to 8 glasses of water spread throughout the day. Stop large amounts of fluid about 1 hour before bed so your sleep is not disrupted. The second habit is a 10-minute walk after your evening meal. A short walk after dinner lowers blood sugar, reduces post-meal blood pressure, and improves circulation throughout your cardiovascular system. Research published in the journal Diabetes Care found that 3 10-minute walks after meals were more effective at controlling blood sugar than a single 30-minute walk. For people over 70, this is one of the most powerful and accessible habits you can build starting tonight. The third habit is to sleep on your left side. This sounds almost too simple to matter, but the science supports it. Sleeping on the left side reduces pressure on the vena cava, which is the large vein responsible for returning blood to the heart. It also supports better lymphatic drainage and may reduce the nocturnal blood pressure spikes that put your cerebral arteries under stress through the night. Many cardiologists recommend left side sleeping specifically for older patients with hypertension and heart disease. Let me bring everything together for you now. After the age of 70, your body handles sodium very differently than it did when you were younger. Your kidneys are slower, your blood vessels are stiffer. Your ability to regulate blood pressure during sleep is more vulnerable than it has ever been. When you eat high sodium processed food in the evening, soups, crackers, deli meats, instant noodles, packaged cheeses, you prevent the natural and essential nighttime drop in blood pressure. That elevated nighttime pressure puts continuous stress on fragile cerebral blood vessels for hours while you are completely unaware. Over time, that stress leads to the plaques, clots, and vessel damage that cause strokes. The good news is that this is one of the most controllable risk factors in your life. You do not need a prescription. You do not need surgery. You need to know what not to eat, what to eat instead, and 3 simple habits that your cardiovascular system will thank you for every single morning you wake up healthy. I am Dr. Daniel Chen. If this video helped you, please share it with someone you love who is over 70. It could genuinely save their life. Subscribe to this channel because every week I bring you medically accurate, practical information designed specifically for older adults who want to stay sharp, stay strong, and stay well. Leave a comment below and tell me which evening food you are going to replace starting tonight. I read every comment and I would love to hear from you. Take care of yourself because you deserve to live long and to live well.